We have selected several practices, but one that I wanted to bring today, it's a practice that aims at improving digital skills to help to increase quality and resilience of the Italian health systems. It's a practice that we selected because it covers different elements that are key to the work of the entire health working group. So the digital dimension, for sure, it's one of them. But at the same time, it's very important because it has a very structured approach that connects with both the regional and the national dimension. So that's very fundamental. It's a very comprehensive approach. So it brings together also other stakeholders and not only, let's say, the regional authorities dimension. And equally, it's very important because it's super timely and relevant as it connects not only with the general need to improve digital skills, which is recognized, as a key element of the health sector, but at the same time, it connects really strongly with other key European initiatives, such as the TSI, the Technical Support Instrument, and the Path for Skills. There are several interesting elements that the practice has, and they kind of can be taken out as some insights. Well, first of all, I think the structured approach, the structured and comprehensive approach that has, it's very important because it looks at a systematic integration of digital skills, in the health systems, that looks at different actors that needs to take this transformation forward. This is the second element, so this multi-stakeholder collaboration and stakeholder engagement at all levels. The healthcare system is very complex, so you really need to have a series of actors that align with you and take up the initiative and the good idea that you have to make it actually work in practice. A couple of other things that are very important is the regional dimension itself, so the adaptability across regions. This is important because looking at a single country that is split in a huge number of regions that on its own they have their own differences, I think it represents a really good practice that can be also taken up in other countries with equal number of smaller or more number of regions, but that face the same difficulties and the same challenges, meaning that at a regional level, it's not necessary that you can find maybe a region with the similarities within the same country, but maybe can be taken up in another country. So having this dimension of adaptability across regions, it's very important. Finally, impact measurement. I think, the practice also looking at a series of KPI that are always important to have, because otherwise you cannot really understand if the practice is working, having an impact on the healthcare professionals.